Namaste and welcome to the Recover series presented by Apollo Hospitals. This is Dr. Srinidhi Chidambaram. I hope that you've been finding our sessions informative and educative, and I hope the guidance on various topics related to COVID-19 and recovery from our experts from the various specialties that we have been talking about over the last weeks have helped you tackle the COVID pandemic with calm and confidence. And as the country opens up from all the lockdowns, please do remember that our weapons to fight COVID-19 remain the same. What we call as SMS, which is the social distancing, the mask, and the sanitizing, and a very powerful weapon that is most important and effective in keeping the virus at bay, and that is the vaccine. Despite the host of vaccines that are now available, there has been some amount of hesitancy in taking them, though the situation is much improved and the mindset is changing now. But for those who are still hesitant, think of the vaccine this way. Everyone is eager to get back to normalcy at work, school, sport, social events, family celebrations, going out. Though no one is sure when the pandemic is going to end, every person who gets the vaccine and is protected is also helping others and helping us move closer to a normal life. On the other hand, waiting for too long to be vaccinated will cause the virus to continue spreading in the community and also give it a chance to mutate and cause many variants like what we are facing now. And on the personal front, taking the vaccine is the most powerful step you can take now to take charge of your health. And vaccines do prevent severe COVID-19 hospitalization and death. So to discuss all this and to give us a complete overview of COVID-19 vaccination, clear all our myths and misconceptions, I welcome Dr. V. Ramasubramanian, who's going to tell us, don't wait, vaccinate. Dr. Ramasubramanian graduated from the Madras Medical College and did his post-graduation in internal medicine from the PGI Institute, Chandigarh. He trained in infectious diseases and HIV in the United Kingdom after getting his MRCP. He also obtained diplomas in tropical medicine and hygiene from the London School of Tropical Medicine and in genitourinary medicine from the Society of Apothecaries, London. After he returned to India, he played a pioneering role in establishing infectious disease as a specialty in India and was instrumental in laying down the principles of infection control in several hospitals. Dr. Ramasubramanian is currently a senior consultant in infectious diseases, HIV, and tropical medicine at Apollo Hospitals and a professor of infectious diseases at the Sri Ramachandra Medical Center and the MGR Medical University, Chennai. He has authored several research publications and chapters in textbooks and is a sought-after speaker and teacher. So please tell us, welcome Dr. Ramasubramanian please thank you for joining us. And I know that you're extremely busy with several consultations and talks and lectures. I'm so happy that you've joined us amidst your busy schedule. So do tell us why we should not wait to vaccinate.
Thanks, Dr. Srinidhi, for having me over, and it's a pleasure to be talking to you again this afternoon. Now, vaccines are something which have been around for probably over a century now. It was initially found that people who developed the disease or the infection naturally, the possibility of running into complications and dying was significantly high in people who had not been exposed to the infection in the past. We also learned that if somebody gets an infection naturally, the body is able to produce antibodies which will, to a certain extent, and in several viral infections, to a significant extent, prevent a secondary infection of the same virus. We have seen that with smallpox, chickenpox, measles, mumps. So once I have had the natural infection and recovered, I am able to withstand and fight the second time the bacteria or virus comes around much better, and unless my immune system is damaged. So based on this, doctors of the 18th and the 19th century worked to isolate what caused this body's immune response against the infection. And they found that using some antigens or some protein from the virus or the bacteria and injecting into the body, which will not cause the infection, but which will alert the body to produce antibodies against this protein, will subsequently result in the body having enough antibodies to prevent the same infection if it comes naturally. That is how vaccines started. And we now accept vaccines as part of the natural process of medical treatment or growth of any child all over the world. Vaccines are very well accepted for children. But there is still a lot of hesitation amongst adults. In children, we don't think. When we have a child, we vaccinate them automatically. But when it comes to giving ourselves a vaccine, giving vaccines to our elderly parents, we always wonder, what could be the side effect? Do I need it? What will happen if I don't take it? Questions which to me a lot of times should be asked, but I find there is a lot of unnecessary worry and panic about these things. And that is what we are facing with COVID. The only simple statement I can tell you is taking the vaccine is any day safer and better than going through the disease. So this is the only point which you should remember. So in the next 3 or 4 minutes, I will briefly tell you about the vaccine so that then we can go ahead with the questions. So if you are now talking about vaccines for COVID, we have again realized that a person who is unvaccinated and develops a natural infection, the chances of running into complications can be somewhere in the region of 5 to 10%. It's a very rough value. Or 20% may require hospitalization, 5% may require ICU admission, and 1% or so may end up dying. Especially if you are older and with other comorbidities, your chances of complications is much higher. To prevent this, we vaccinate a person whereby we inject the same spike antigen which is found in the virus into the person's body so that the body recognizes the antigen and produce antibodies which we believe could be protective. We have now known that even if you develop a natural infection, the antibody level starts declining after 3 to 6 months, and we may be prone to a secondary or a reinfection after 6 months or so. So which means that even people who have recovered from COVID need vaccines to keep their immune system boosted. And the response sometimes which is induced with the vaccination is more robust than a natural infection, which sometimes may be very mild. So everybody needs vaccine, even people who are infected, irrespective of the underlying problems, because the other question is, people have a lot of concerns that I have this problem, my father has this problem, I have this allergy, I have that issue. Irrespective of any underlying problem, it has been shown that vaccines are safe. The only questions are that if your immune system is compromised by a chronic condition, say for example, an autoimmune condition, you've had a transplant and you're taking medicines to suppress your immune system. In such situations, the immune response may not be very robust. Other than this, the safety of the vaccine, I don't think there is any questions. There are 1 or 2 instances which probably we shall discuss subsequently. So we have known about what are vaccines. We have learned about who needs vaccines, which means the bottom line, everybody. And right now, since children are not licensed to get the vaccine, except Pfizer for children between the ages of 12 and 15, most vaccines are currently licensed, even for emergency use, only above the age of 18. When do you have to get the vaccine? The simple answer is at the earliest. Don't wait around for a good vaccine. Whatever is available and whatever you are eligible for right now, in whichever country you are, take the vaccine. There are a lot of questions coming up. If I take the Covaxin and it is not licensed by the WHO, if I travel out of India, what will I do? So there will be questions which will be slowly evolving and we will find answers with time. But I'm talking to you strictly with the view of keeping yourself safe and healthy. So take the vaccine at once. What vaccine? Doesn't matter. Whichever is available, just take it. Sitting around and waiting for the ideal vaccine is only going to increase the risk of complications. And lastly, how right now Apollo is having a massive mega vaccination camp. Just call up or book your appointment through the Apollo website, which will be short. Take your vaccine at the earliest. So this will be the concise introduction to vaccination. I'm just going to add one more question before we ask questions, before we open out. Raise an issue. There is a question about the safety of some vaccines. Please remember, nothing is guaranteed to be 100% safe. And if you look at that, the Pfizer and the Moderna vaccines are associated with a higher risk of allergy and anaphylaxis. 10 times higher than what is seen with conventional vaccines available now. But it has been shown that this is not related to other allergies you may have for food or for medicines. There is no cross reactivity, so just take the vaccine, but make sure that you're observed for at least 30 minutes after the vaccination, because any reaction is likely to happen immediately after the vaccine. The second significant side effect is the question of thrombosis or blood clotting, which can be induced specifically, mainly seen with Covishield, but also with the Johnson & Johnson vaccine. The Covishield reaction of blood clotting is seen in specifically younger women, and this typically happens after the first dose. It is seen anywhere from 5 to 20 days after the first dose, associated with a low platelet count and an increased risk of clotting in any blood vessel in the body, which can sometimes be serious. But to give you a perspective, this happens 5 cases in 1 million. If I extrapolate it to see what is the risk of clotting associated with people who may be on the oral contraceptive pill, it is somewhere in the region of 50 to 100. For a smoker, the risk is about 150 to 200. For a patient who actually has COVID, this risk is 10,000 to 15,000 per million. So if you look at the risk, which is 5 per million, and the risk of clotting with COVID, which is 10,000 to 15,000 per million, I think it's a no-brainer that this is a risk definitely worth accepting to prevent the complication of COVID. So I'm going to stop here, and if there are any questions, we can start with. Otherwise, we can take issues as they come along.
Yes, there are some questions, but before that, I just wanted to ask you about the gap between vaccines, because there has been quite a bit of going forward and backward on that. And we recently saw this study which says that if you take it after even 10 months, it is better, something like that. So what is the ideal thing, or should we just let, is there going to be a change in the time between for Covishield, that is for the first and second?
I think for most vaccines, it is fixed. For Covaxin, it is 4 weeks. For Pfizer, it is 3 weeks. For Moderna, it is 4 weeks. For most other Chinese vaccines, it's all fixed. There is no worry about it. The confusion has always been only with Covishield, because after the initial studies, they found that during the study program, those who had a delayed second dose for various logistical reasons actually performed better with regard to the antibody levels. So if they had a longer interval, the antibodies were much higher than when they were given a 4-week interval. So based on that, the recommendation should be that they are recommended the second dose at least 3 months, which is 12 weeks after the first dose. I don't think there is any confusion about that. It is always better to have a second dose after 3 months than 1 month with regard to your immune response. But having said that, recent studies have shown that the variants which we are coming across now, typically the Delta variant, which is the main cause of the second wave in India, actually responds less effectively to vaccination. So if I've taken the vaccine and I've been exposed to a Delta virus, then this protection is not as high as 80%, which is what I would otherwise have if I had taken Covishield vaccine. For a non-Delta virus, that is the original Wuhan virus, the efficacy was 80%. But if I am taking 1 dose of Covishield and I'm exposed to the Delta virus, my protection is only 30%. And after 2 doses, this increases to 60%, which means it is still less than the 80% I would have against the original virus. The Delta virus protection is only 60%, and it is 30% if I have only 1 dose. So one of the arguments is, if I'm going to wait 3 months before I get the second dose and get a Delta virus infection in this interim period, I can get the infection. So doesn't it make sense that if I have 2 doses at the earliest, so that my protection against the Delta variant is more robust? Yes, that is an argument, but we have to look at other issues also.
What about the boosters? So will we be getting, for those who have had this, a lot of us had the vaccine in the early months of 2021, where just 5-6 weeks gap. Now it has been changed to 3 months. So will there be also boosters that are coming up with, like how we have the flu vaccine? Is that still a possibility, or we don't know yet?
It is definitely a possibility. In fact, right now a study is going on where they have found that if a 3rd dose of Covishield is given 6 months after the second dose, that boosts your immunity even better. So would that be the standard of care with regard to improving your immunity and especially tackling the variant viruses? Yes, we have to wait and see. There are no recommendations. The data is still very early and minimal, but probably boosters after 6 months or maybe after a year definitely is on the cards.
So what about the Delta Plus variant? Now that's the current thing. So is that also supposed to be quite responsive to the vaccine, or we don't know yet?
We don't know yet. There have been less than 100 cases which have been seen so far or identified so far in India. The difference between the Delta and the Delta Plus is that there is an extra mutation which we know definitely may compromise the efficacy of monoclonal antibody cocktail, which is given as a preventive therapy to avoid complications. But what is the effect of a Delta Plus mutation on the efficacy of the vaccines? We still have to wait and see.
In fact, one commonly asked question, I'm sure thousands of people have asked you, is that, we have taken one vaccine or even one dose or 2 doses and we still got it. So what are the different scenarios in which this is likely to happen?
See, it is very clear that vaccines prevent death. At least the original virus against which the vaccines studies were done prevented death 100% of the times, minimize the risk of complications to almost less than more than 90%, and prevented symptomatic infection to a tune of about 70%. So vaccines definitely help, but we know very clearly that vaccines don't block infection. You can still get infected, but you will fare much better than somebody who has not been vaccinated, especially if you're older. So the chances of hospitalization and severe infection and complications and death are significantly minimized by the vaccine. But with the arrival of the new variants, which may have ability in higher risk of transmission, higher ability to evade the diagnostic tests, the ability to probably resist monoclonal antibody therapy and also escape the protection from vaccines, makes it a lot more difficult. But in spite of all these, it has been very clearly shown, even if the efficacy is less, there is still an efficacy, and still there is a strong recommendation to take your and complete the dose of vaccination at the earliest.
What about some groups which are considered to be vulnerable, like the pregnant women or the breastfeeding mothers? What is your recommendation for them? Can they?
Yeah, I think there were a lot of questions because the government hadn't approved of vaccinating pregnant women and breastfeeding women. Till recently, the breastfeeding women were approved, and recently, about 3-4 days ago, the government said you can go ahead and vaccinate pregnant women also, even though the vaccine is not licensed for use in pregnant women because studies haven't been done on pregnant women. But having said that, we realize that the mother's health is more important than the health of the baby. It is very important that if a pregnant woman has a higher risk of complication and the chances of complications with vaccine is going to be very minimal, which is what we have seen so far, she definitely needs to be told and a vaccine needs to be offered for pregnant women. One other area where there is some concern is the role of vaccines in people who may not be able to respond well. As I told you, we know that the immune response is based on the body's immune system, and people, as I said, who may have had a cancer, people who are on immunosuppressive medications like steroids for whatever, for transplantation or autoimmune conditions, even vaccinations may not be able to boost their immune response. So there are studies available. A recent study in the New England Journal of Medicine says that in this situation, instead of 2 doses, if you give 3 doses of vaccination, the antibody response is much better. So I think we are still learning. We will be coming across situations where we have had problems, and by applying what we have learned from other diseases, we should be able to tackle them better.
Coming back again to the pregnant women, is there any recommendation that it should be taken early on in the pregnancy, in the early trimester, or is it just that get it at the earliest?
If there is an outbreak going on in your community, I would give the pregnant woman a vaccine at the earliest, irrespective of what week of pregnancy she's into. But if there is no such outbreaks and you can wait, the number of cases is very, very minimal, I probably would think of it in the 2nd trimester, because that way you finish the 1st trimester when actually all the organs in the baby develop. So if you're worried that the vaccine may cause some problems with the development, the 2nd trimester, which is after 3 months, is better. But if there is an outbreak, don't wait, just give it at the earliest. We also know that the complications in pregnant women typically happen later, which means after 6 months or 8 months. The chances of a stillborn birth, the chances of premature delivery, all that is greater. So the peak time is second and third trimester. But if there is an outbreak going on, I would suggest an earlier vaccine.
There are a lot of myths and misconceptions which have been going around, but I mean, what is the current most common misconception you think, or because I know that the people were talking about future infertility, or they were talking about people getting heart attacks and other complications, or getting other infections after the vaccine. They were saying that it depresses the immunity. So maybe we could look at some of these things and clarify that there is really no depth or any foundation to these kind of things, which largely come through social media.
Right. We know that the infodemic which we are facing, the false information which is spreading viral through the social media, is the main reason why there is a lot of vaccine hesitancy and vaccine apathy. There were three main reactions which people attributed to the vaccine, which still, unfortunately, people are asking me on a daily basis. One is the fact that, can the vaccine cause the infection? Because during the second wave, a lot of people who had the dose, in the next 2 to 3 weeks, they came down with COVID. Let me make it very clear that the vaccine can no way cause an infection in a person, even if your immune system is very weak. The vaccine injects only certain particles of the virus which by themselves cannot cause infection. So vaccine will not cause infection. A vaccine will not make your PCR test positive. A vaccine will not give you changes which a natural infection can. So that is definitely to be put into the bin. The second issue was with the idea of, what about infertility? Infertility was quoted because there was a scientific paper from a very reputed scientist who said that there is a cross reaction between the proteins which is found in the viral spike antigen and certain genetic proteins which are found in the egg or the sperm. So if there is a cross reactivity, the antibodies which are directed against the proteins in the spike antigen may also turn against the sperm or the egg, thereby ensuring that you may not be able to conceive, you may become infertile. But this has again been proved wrong, because this crossover of proteins is seen with several other vaccines with which we have had no problems whatsoever. So that is also been condemned down. The third issue is the question of blood clotting. Now, this all came about with the Covishield vaccine, and as I told you, the Johnson & Johnson vaccine has also been associated with slightly risk in the occurrence of blood clotting. So there was a lot of information going on. Should I do a CRP test before the vaccine? If the CRP is high, that means that I'm having inflammation. The vaccine may precipitate a clot. Should I do any other test? Should I do a D-dimer test? All that has also not withstood the scrutiny of evidence which is available. We know that these are all theoretical constraints that whether vaccine may increase the risk, but so far we don't have any scientific data to confirm or back up the claims that thrombosis or blood clotting is increased after vaccination. So we still have to wait and get more information if at all it is possible.
Regarding people who have had one dose and then who have developed COVID, or if they have developed COVID, when is the earliest that they could get the vaccine? Because here again, there is a little bit of confusion, 3 months or 6 months. So what is ideal?
There is a little dichotomy with this, because the CDC, the Center for Disease Control in the US, has said that if you develop an infection after the first dose, as soon as you recover and you are out of isolation and quarantine, you can take the second dose. This is mainly because the US, the doses available are Pfizer and Moderna, and the interval is much shorter, 3 weeks for Pfizer and 4 weeks for Moderna. So as soon as you recover, just take the vaccine. In India, the government has said, wait at least 8 to 12 weeks after you recover before you can take the second dose of the vaccine. If it's a Covishield vaccine, it is okay, because the time interval is 3 to 4 months and you have enough time. But what about the Covaxin? Personally, I think once you recover, you can take the Covaxin if it is available, because that way you are able to keep the schedule, and in spite of the infection in between, shouldn't make a difference. But the argument against this is, if the infection has happened, that itself will act as a booster. Normally, 2 doses of vaccine are given, where we say the first one is the priming or the prime dose, which stimulates the immune response, and the second dose is the boost dose, which boosts up and ensures that the antibody levels are maintained for a longer period of time. So if the prime dose is given and you develop an infection, that itself will act as a boost. And the third dose given, the second dose given after 2 to 3 months should be adequate. We still don't know. We have to see. But again, the bottom line is take the second dose whenever it is possible. If you want to recover for 2 months and then take it, that is fine. But ensure that you take a second dose. Yes.
We now will take some questions which are coming from our live feed. So I'll read them out for you. The first one is about when can we get the vaccination after recovery? We just discussed that. Can a diabetic patient take the vaccine?
I told you, I repeat, any underlying condition, the vaccine is safe. The only contraindications are, as I told you, in children, if you're running a high fever or if you have had an allergy to an earlier vaccine. Other than that, there is no contraindication.
How long does the protection from the COVID vaccine last? And this also is associated with another question about the practice of, some people keep checking their antibodies after the vaccine and comparing it. And, I have 1,000, you have only 20. So how does all that affect, the whole thing?
The vaccines have been around for less than a year. We know now the vaccine antibody response definitely lasts 6 months, probably up to a year. But if only time will tell us that if it will last longer. There is no role for antibody testing at all. Other than India, I don't think any country does antibody in a commercial situation. They always do as part of a study or a trial. There is no role for antibody testing because they don't tell us what is a protective level. They do not tell us that if antibodies are negative, then you are not protected, because there are other mechanisms by which the immune system can be protective, initiated by the vaccine. So in such a situation, I don't advise antibody testing for anybody, not for reasons of checking whether I'm immune or not after vaccines.
Can I get vaccinated against COVID-19 while I'm currently sick with COVID-19?
No, it is advised you get better and then you take the vaccine. And if you've had a natural infection, the current recommendations are you can safely wait for 3 months before you start your vaccinations. If you've had the first dose, we discussed earlier what the interval should be.
I've taken both doses of Covaxin. Am I safe against the Delta Plus?
As I told you, taking 2 doses of either Covishield or Covaxin does offer you protection even against Delta or Delta Plus. But how effective is this protection is still to be seen. But you are definitely better off than not having the vaccine.
This also we discussed, should I get the COVID-19 vaccine if I'm breastfeeding? And I think the recommendation is can someone who has taken Covaxin 2 doses 6 months ago take a booster dose of Covaxin or even take a different vaccine like Sputnik or Covishield?
With regard to a routine injection of a vaccine, we still don't know. We have to wait and see. But I can give you a couple of scenarios where we may need to do this. One is there are countries where, for example, if I've had my first dose of the Covishield vaccine and I go to the US where Covishield is not available, can I take the second dose of either Pfizer or a Moderna vaccine? Or if I'm somewhere in Europe or the Scandinavian countries where certain other vaccines are not available, can I take an alternate vaccine? If I've had the Pfizer, can I have the Moderna? If I've had the Moderna, can I have a Covishield? Studies are on in situations where the vaccine is not available and the person is compelled to take a different vaccine. With the limited knowledge we have, we can say that this is not harmful. Whether it will be as effective or even more effective when you mix the vaccines than take one vaccine, we still have to wait and see. But it is not harmful. People have taken it. It is safe. The second is, I find a lot of people traveling from here, for example, to the US to study. They may be children who have had 2 doses of Covaxin or 2 doses of Covishield. And in the US, the university doesn't recognize or approve these doses. And they are forced to take another series of 2 vaccines, either Pfizer or Moderna. I know people who have done this. And as I said, this has not been shown to cause any harm, but whether it will be beneficial, we have to wait and see. So we are still gathering information on this. I, in fact, had one patient in the US who was wrongly given the second dose of a different vaccine. The first dose was Pfizer and the second dose was Moderna. The person did fine. But what impact it's going to have, I don't know. We have to wait and see.
And there are also some people who, like as new vaccines keep coming. Say, for example, if we get the Pfizer or Moderna, they might want to have a go at it, just to.
No recommendations as of now.
My mother is 69 years old. What vaccine can she have? Covaxin or Covishield, and she's also taking Clopilot.
It doesn't matter, whatever vaccine you can get your hands on, just ask her to take it.
I have taken steroids till 11th May, and I had COVID on 22nd April. When can I take the second dose?
As I said, 3 months after you recover is what would be an ideal time.
I've had a history of eye myositis and autoimmune disease from 2017. Currently, I'm fine. Can I take the vaccine?
Absolutely. Please take it.
I underwent myomectomy in February 2019 and a C-section in January 2021. Can I take the vaccine? I have to take the second dose of hepatitis B in July. Meanwhile, can I take the COVID vaccine now? Will it interfere or create any problem?
No problems, no interference, you can take it. The current recommendation is to avoid any other vaccine at least 2 weeks before or 2 weeks after you take the COVID vaccine. This was initiated so that we could get a better idea about what the side effects could be. But I think now there is no issue. If, for example, you need a rabies vaccine a few days after or a tetanus vaccine, you can go ahead and have it. I don't think there is any interference with the vaccines.
When can my 6-month-old baby take the vaccine?
Right now, probably 12 years down, but we have to wait and see. That's only the Pfizer vaccine after 12 years, but we will know very soon. In the next few months, there are a lot of vaccines coming out. Even in India, the Cadila vaccines are likely to be licensed for children, hopefully in the next 3-4 months.
My daughter is allergic to certain medicines. She already has COVID. Should she get vaccinated?
I presume she's over the age of 18. The allergies are not a contraindication for the vaccine, and she can take the vaccine 3 months after she has recovered from COVID.
My mother has thrombophlebitis. Is it safe to take Covaxin rather than Covishield?
Anyone is fine. There is no connection between thrombophlebitis and the vaccine.
Can I take 2 different vaccines? We have already answered that. I'm on gabapentin for numbness of legs. Is it okay to take the second dose of vaccine?
Yes, it is fine.
I think, yeah. I'm 55 years old. I have BP, taking Concord 5 milligrams. I have severe sinus headaches, but is it okay to take the vaccine?
It is fine.
Okay, I think that brings us to the questions. Sorry, there's just one more. I'm 33. I want to take Covishield. What if I get clots? When will I get them if I'm getting them?
I think any intervention, before you plan the intervention, there is something called the pre-intervention probability. So this is as good as it could be a Covishield vaccine. It could be driving on the road. It could be cycling. It could be mountaineering sports. Again, to give you a corollary, the risk of the AstraZeneca Covishield vaccine in young women causing clots, let us say, is 0.5. If you take a number, the risk of mountain climbing and the complications can be as high as 15 or 14. The risk of scuba diving is about 12. The risk of bungee jumping is about 2. So this will give you a perspective of what the risk is with, for example, bungee jumping, which is 4 times higher than the risk you would have with Covishield vaccine. So yes, there is a small possibility, but this is a very, very small possibility. And if no other vaccine is available, go ahead and take the Covishield. That's any day safer than sitting in fear.
I took 2 doses of Covaxin. I have severe hair loss. Is it a side effect of the vaccine?
Not that we are aware of yet. It could be due to other reasons, but it is still too early for us to say that it is definitely not. But I have not come across any significant. Its hair loss could be due to several other reasons we need to look at.
My father is 80 years old. He's allergic to azithromycin and even to some other medicines. And
No
I'm very
problem.
confused to get him vaccinated or not.
No issues. You can. There is no reaction between this and the vaccine.
Okay. I'm 32 weeks pregnant. Can I take the vaccine or wait till my delivery? We have.
No, I would suggest go ahead and take the vaccine.
Can a psychiatric patient who is already on some medicines take the vaccine?
Yes, yes. He can.
I'm 40, allergic to amoxicillin and ampicillin. Can I take the COVID vaccine?
Yes.
I recovered from COVID last May. I'm under treatment for SLE. Can I take my vaccine?
Now, if you're on high dose of steroids, more than 20 milligrams per day, that will impair the body's efficiency to produce antibodies. So if it is likely that you're going to come down on the steroids in the next 4 to 8 weeks, it may be better to take the vaccine after your steroid dose is much lower. But if that is not going to happen, you can go ahead and take it. As I said, we are likely to come up with boosters or a second series after 6 months or 1 year. Let us see how that pans out.
Can painkillers be taken post-vaccine?
Yes. Paracetamol is perfectly
I think that brings us, I think, to the end. Oh no, there's one more. Sorry, a lot of questions in this session. My friend's father has polio, so can he take the vaccine?
Absolutely. These are not related in any way to the vaccine.
Okay. Okay, so this brings us to the lot of questions this time, and thank you so much, Doctor, for answering them very patiently and giving us an overall idea about vaccines and how we should not hesitate and just take it. Thank you so much for joining us, and thank you viewers for joining us too. Please join us for the next session, which is on 2nd July at 2 p.m., which is going to be about the post-COVID fungal infections, precautions and preventions, to be discussed by Dr. Venkata Karthik KN from Apollo Hospitals, Chennai. Please subscribe also to our YouTube channel, and you can get all these videos and latest health information and updates there. And if you have more queries, you can always reach us on our Facebook page. So meanwhile, till we meet again, take care, be safe, and don't forget the 5 W's of COVID-19. All the precautions and COVID appropriate behaviors, what are they? You know them very well. We've already said SMS, social distancing, wear the mask and sanitize, when, every time, where, everywhere, who, everyone, and why, of course, to stay protected from COVID-19. Thank you very much. Thank you, Dr. Ramasubramanian. Namaste.
Thank you.